protocol and using technology. Primarily because, well, I've been teaching with PowerPoint for a long time. You know, back when we had overhead projectors. But I'm telling a story about making a story, and that story was a video. And so it felt weird to tell you about creating a story in which then I couldn't share the story with you in the form that we created it. Our goal was to educate people about the social determinants of health. Social determinants of health, widely accepted in public health. The idea, we stole it from sociology, but aside, it answers the question, why are people healthy? Why are people unhealthy? Certainly my behavior, my genetics matter, but so does my family. I grew up in a family that smoked. That certainly impacted my childhood behavior. Oh, and probably health too, even if I didn't choose to smoke. The community matters. Do you have a walking trail in your community? I'm evaluating the downtown Greenway. It's so nice to be so close to it, right? Do you have walking trails? Is your community safe? How about the organizations within the community? They impact my health, right? Are the schools delivering evidence-based alcohol and other drug prevention programs? Or are they delivering a program that's convenient and popular? And then certainly policies matter. Policies and state laws, right? The seatbelt law saved lives. So prior to this effort, my colleague, Bob Strack, he's the chair of the Department of Public Health Education at UNCG, he had already revisioned the social-ecological model. This was a PowerPoint presentation that he was running around, and he was using the metaphor of Sisyphus instead of these concentric circles for lots of reasons which we don't have time. Research. This research was important to us. The Robert Wood Johnson Foundation did a large research study about why people don't understand the social determinants of health. We public health people get it. Why aren't policymakers getting it? Why aren't the public getting it? And lots of good stuff in here. One of the things they identified is that we all have deep metaphors or frames or filters on how we interpret health or how we assign blame for health disparities. And so pardon the dualism and the binary here, as these aren't my words. But what they identified were that Democrats see health as a system, a container, and balance. Republicans see health very differently. It's a journey, it's resources. It's also balance, but don't let this deceive you. Even though the word is the same, the meaning of balance for both groups is very different. So how can we talk to the public, which includes these folks and more, independents? How can we talk to the public about the social determinants of health? So we had some money. We had some of your money, your taxpayers. We had some money from the National Institutes of Health to create photovoicekit.org, a story for another day. PhotoVoice works with communities and groups to use photography and stories to advocate for social change. To do that, we needed to educate people about the social determinants of health. We are impressed by this book. It's called The Story Wars by Jonah Sachs. And Jonah talked about how who has the best story wins in the world of business. Right? Is it necessarily the best product? I don't know. When I go to the store, I think most of that soap probably works. But which one do I pick, right? It's who has the best story wins. And he had created, so we were impressed by this book. There was also a lot of Joseph Campbell in there. And as a psych major with a love of Carl Jung, I appreciated Joseph Campbell. And it was very intellectual. He created a company called Free Range Studios. We hired them to help us create a story. So, sort of a summary of the process. First thing, they put us through some workshops to identify our values. Who are we? And we need to identify our values because beneath the surface level of every story is a moral. And the moral is based on values, right? So the people we were working with needed to understand us. It was a fun process. They had a bunch of these cards, archetypes, and a cross between a tarot deck and Jungian archetypes, spread them out all over the table, and we had to decide which one represented our team. Of course, we were the problem client, and so 20 cards wasn't good enough for us. And so they had to actually go back and get the advanced deck to bring it out, to give us more choices. And then we formulated the story. Now, I don't mean just any old story. We wanted to formulate the story, the hero's journey. We wanted a story as powerful as Gilgamesh, or the Odyssey, or the Wizard of Oz, the Lord of the Rings, or maybe Apple. Right? That's the kind of story we wanted to create. Here it is. There we go.
No matter who you are, we can all make responsible choices to live a long, healthy life. The path to good health is a journey. Work hard, make healthy choices, and you'll get there. If you find yourself struggling, just keep at it. No pain, no gain. After all, a healthy country is a productive country.
Sorry, I hate to butt in.
Excuse me, I'm trying to narrate a video here.
Yeah, okay, but you're oversimplifying things a bit, don't you think?
What do you mean?
Well, for starters, you need a new perspective on this path to good health. Follow me. See?
What? Why would some people's paths be different than others? That makes no sense.
Well, those inclines are the conditions in which we live, work, and play. Our environmental circumstances have an enormous impact on our health, and they're why some people struggle more than others.
But we all live in America. The inclines wouldn't be that different.
Let me break it down for you. Our paths are influenced by things like our friends, family, and social networks, organizations and social institutions in our lives, our communities, and policies like national, state, and local laws.
All the more reason to roll up your sleeves and push harder. I make the responsible choice to go to the gym every day. All it takes is discipline.
Well, Jane here can't afford gym membership. Her neighborhood is too unsafe to walk in, and she doesn't have time because her daily commute is 2 hours by bus. You see, a lot of people like Jane are working plenty hard, but her environmental circumstances make her journey more difficult than yours.
Fine. Maybe situations are different for everyone. But what are we supposed to do about that?
Well, if our only strategy is to push people to try harder, we're going to get nowhere. Maybe we could make a bigger difference if we focus on reshaping our landscape.
And ignore personal responsibility? How's that fair?
Listen, our behavior definitely matters, but so does our environment. Address them both, and things get better all around. Take driving, for example.
Driving? I'm an excellent driver.
I bet you are. And there's no debating it's up to each of us to practice safe driving habits. But imagine we lived in a time before seatbelts, drunk driving laws, or safe roads and highways. These changes saved lives and money because they didn't just focus on behavior, but on improving conditions for everyone.
Okay, point taken. But how can we change the landscape to improve health?
When enough people start to see the long view, we can work together to improve the landscape and make things better. And with this new perspective, decision makers and influencers, like you, can make a big difference.
I'm listening.
There are lots of ways to reduce the incline. Take a health topic like cigarette smoking. It could mean passing laws to raise the age to purchase cigarettes. And cultural shifts that protect our kids, like taking cigarette advertising off TV. Parents talking to their kids about the dangers of smoking. Or making hospitals smoke-free. This could apply to any health topic. Just like with our driving example, these kinds of changes to our environment help everyone by saving lives and money.
Hey, all the inclines are lowering.
Yep, each of these changes help to make the healthy choice easy choice. And as you always say,
A healthy country's a more productive country.
yeah, now you've got it.
I guess personal responsibility does matter, but so do the actions we take to shape our landscape. With our new perspective on the long view, we can improve the path to good health for everyone.
It sounds like you're ready to start making a real difference, my friend.
I guess I've come around.
Aren't you glad I crashed your video now?
Yeah, I still don't know how you did that.
Okay, so I should have mentioned that we couldn't afford to hire this company to do everything that they were offering. And so this is what they call an MVP, or a minimum viable product. So it's the sketch of a video. If we can find more money, they had ideas for a video, a social media campaign, maybe even a game show where we put people on wedges. They have all sorts of wonderful ideas for the next grant. If we did our job right, you should be able, we don't have time for this, but if we did the job right, you should be able to identify who was the hero of the story, what was his problem, who was the mentor, what was the struggle, what was the gift, and how was the hero transformed or resurrected. This was one of the most enjoyable projects for me because we were able to engage non-traditional partners, right? Not often do public health people get to work with storytelling experts. And so we look forward to continuing this work. Thank you for your time.